call this meeting to order. The Richland County Community and Health Services Standing Committee, August 6th, Thursday at 10:30 a.m. We're all here in the county boardroom. Before I go on, we do have a new member, but I see he's not here. So we're gonna hopefully have him next time where he can introduce himself to you, new county board member. So if we will move on, Miranda, roll call, please.
Miller. Here. Kramer.
Here.
Welty. Here. Perry.
Here.
Collins Johnson. Here. McAlveen. Ferris. Braithwaite.
Here.
Checker.
Here.
You have a form there.
Thank
Sort
you.
of.
Verification of open meetings law compliance.
The meeting has been properly noticed.
Thank you. Okay, we have a 16-point agenda today, so I would like to have a motion to approve that agenda.
So move.
I need a second. Anybody want to make changes or move anything around? If not, all in favor, please say aye. The agenda is approved. Approval of the minutes from the July 2nd, 2026 meeting. Everybody had a chance to look at those. Have a motion to approve the minutes.
I so move.
Okay. We have a second.
Chair,
Yes.
were you recognizing Paul?
We'll do Mary Collins Johnson. And second, Mr. Perry. Quite welcome. Okay. Any changes or anything that needs to be discussed on the minutes? Hearing none. Minutes are approved as written. Number 6. Public comment. Anybody have anything to say that's online or here in the room? Hearing none. We're moving on to number 7, reports. We're going to start with the HHS Director, Administrative report, please.
Hi, hello, everybody. So to start off, the first thing I want to do is I want to introduce the new Business and Financial Services Manager, Nick Marshall. I'm very excited to have him on board. Today's day 14, working day number 14. So already been throwing a lot at him. He's coming in, obviously, budget time. So that's exciting to have somebody to bounce some things off of for that. He has a background in various financial things, project accounting, budgeting, forecasting, reconciliation, all those great things. So I'm excited to use his brain with all of those things. So very excited he's here. The other thing I've plugged in here for this month is last month there was a question about an e-trike. And so I reached out to the program staff as far as like when that's purchased, kind of what are some of the next steps as far as kind of keeping an eye on that thing. And we got clarification that once it's turned over to them, it is theirs. They're responsible for all their maintenance. But if something happens to it and they ask for another one, there's a process to go through for that. So and when purchases that amount are needed, they're requested, it has to get approved by the state. There's a special process that has to get followed for that. So hopefully this clarifies that a little bit because you're probably going to see more of those in the future. So same kind of thing. The ADRC was lucky enough to be the host of the Southwest Wisconsin Regional Nutrition Directors meeting. And they did a huge thank you to Tanya, our nutrition coordinator, for all the work she did putting that together. Let's see. Child and Youth Services, I just wanted to point out that they are having a fundraiser on August 13th from 11 a.m. to 1 p.m. The YES program is sort of a summer mentoring program that our youth, one of our youth aids worker works with kids doing some mentoring in the summer. It's a program. One of the things they do is they do a fundraiser and then they make a donation to a nonprofit of choice. And this year they're going to, proceeds are going to go to Ada James Passages. So if you're not doing anything that day, it's a car wash, food, come over and get your car washed. Now, granted, it's teenagers, young. So you get what you pay for, but, it's a great thing. In the behavioral health unit, we just wanted to point out that we just filled a CLTS birth to 3 case manager position that's starting next Monday. We're very excited about filling that position because those are programs that, we always try and make sure we don't have kids on wait lists and that they're getting services. Economic support, busy doing what they do. Sorry, I thought I had made a note of something that jumped out at me, but it's just busy doing what they do. The lead economic support specialist position got approved last month, and so we'll get that posted and do the recruiting for that. Health and then public health, just updates on the various communicable diseases. Animal bites they've been busy with animal bites. I do know that. And they're still doing outreach for tick bite prevention as the summer progresses there. So tick bites are pretty prevalent right now. And then I just wanted to once again invite everyone, especially I was going to say the new committee member, to reach out and if he has any questions or any of you ever have any questions, don't hesitate to reach out. Program questions ahead of time. Be more than happy to answer them. So I'm going to talk about budget later. Definitely reach out if you have any. If you want a one-on-one and want to learn more about the budget in more detail. I'm welcome to have you give us a call.
B, Health and Human Services Expenditures Report.
So this month I'm going to do this. Next month, we'll see how he feels next month, but told him I'm not gonna take it easy on him. So in our packet, it was mentioned to me that if you saw some red repeat numbers from last month, we fixed them. It's all up to date, it's all current. So these are the good numbers. Driver expense reports, those are our normal expenditure report, our expenses for our transportation drivers. That's nothing that's out of the ordinary. If we move on to other expenses, we have Nick and I reviewed it yesterday. Nothing jumped out except down kind of at the bottom. You'll see rural Wisconsin and RTP Wisconsin. Those don't normally show up on this report. Those are contracted. Those are contracts that we have. Rural health is for birth to 3, and then RTP array is our sick high interest. So those normally are on our contract monitoring reports that we do quarterly. So if you're curious about those expenses, those got put on this one inadvertently. So we'll have those pulled out and we'll report out on the contract monitoring report for them. You'll see a couple of expenses, like a big one to Simon's Rec Complex. If the child is on CLTS, there's certain situations where they can be authorized for recreation purchases, and those go through our CCOP program, so those are reimbursed. But these are so big because those are several children, right? So they would have gotten like assignments asked for multiple families. Yes.
Is Simon's the only option that's available to the children that qualify for that program, or are there other places or programs they could?
It depends on yes, we could, if we wanted to contract with a different pool, we could. I think the city of Richland Center, you'll see them on there as well. They can go to their pool. It's just where there are other options. It's not the only one.
Except in the winter time.
Except in the winter time. And then maybe we'll set them up with a pass for a ice skating rink. I don't know. I think if we jump ahead to the bank, US bank statement, I think there was I wanted to point out the lodging, the verbal lodging and Holiday Inn lodging. That was for the Nashville trip that the treatment court team went on. So that's paid for out of the opioid settlement funds. So they had one location picked, but then this other location popped up that worked out better for the whole team to be able to stay a little more connected. So, and it was still within the grant request amount. So, any questions? those specific purchases.
Anyone else? Anyone online?
Nope, I do not.
All right, moving on to the budget summary and the county placement report.
Sure. So I'm gonna do this again. Nick, well, once he gets his feet wet, he will be taking this part of the reports over. But he did work with me on creating this. We worked together, so he's already learned some Tyler tips and tricks to fill in the blanks. We kind of reviewed it yesterday to kind of see we are in the middle of June. So we should be at about 50%. This is as the end of June, so we should be at 50% utilization. You can see we're under for a few, we're over for a couple. So we kind of did a review of some of the details. For administration, just slightly under. We did have a vacancy in June because I was waiting for this position to get filled. Public health, the same. We're short of public health specialists, vacancy there. Elderly services. Oh, nutrition, that was the big one. If you're wondering why that's so low, we did budget to purchase a new van, nutrition van. And so that's in the budget and we haven't done that yet. I know Roxanne's in the middle of putting that out for bids to get the best deal for us. So so that's why that's really low. I was like, why is it so low? Got it. If we go down to child and youth services, 40.7%, again, vacancies, social worker vacancies. CPS contractual services. So that is like our legal line. So if we have legal fees, things like that, then they come out of there. And so our legal fees are fairly low right now. Our kinship, it also varies based on kinship, kiddos and kinship payments. So just dependent on how many kids we have in placements. For mental health outpatient, I was curious about that one, but we do have the mental health therapist position is budgeted and that remains unfilled. AODA outpatient and treatment court are a little bit low. That is because we don't have a recovery services coordinator right now as well. Birth to 3 program therapy, really low. I did look, that is therapy services are low right now, but again, kid dependent, where we go, what kind of services they need, what kind of therapies they need. So there's that. We plugged in our anticipated received revenue, our anticipated revenue, which is anticipated revenue is revenue that we've incurred the expense, we've submitted for reimbursement. And we just haven't received it yet. So we try to do a good guess on what we anticipate we're going to get in to cover the costs. And at the end there, I'm showing a new corporate budget balance of around a negative 52,000. Not concerned. It's the middle of the year. There are several end of year revenue items that we're still waiting on, like WIMPR, the Wisconsin Medicaid reimbursement. That'll come later in the year. The other thing is enhanced Medicaid, that'll be a lump sum payment we'll get later in the year. So those things aren't calculated into that. So any questions about the budget?
You had position for another RN and have you filled that?
We have not. It is still posted out there. We are still waiting on public health nurse. That's really the one we would like to fill. I've been having conversations with Randy Anderson about at what point do we switch that and try and fill it with a public health specialist instead. So but we haven't made that transition yet.
Thank you.
Yeah, you're welcome. And no, and then the placement report. So the placement reports, we are at about 68% utilization. At 68% utilization. The one individual, the high cost placement, in August for this month, It looks promising to move the individual to this lesser restrictive setting. And we're working closely with that location to become CCS certified, so credentialed, so that some of those costs will be covered by CCS. So right now, it does not look great. It should be at about 50% utilization. I did have a question about how do we budget? Do we budget based on days or individuals? And we don't budget based on days or individuals, just because each facility's cost is different, could be different. So each day's, the daily rate is so different. So we will we'll budget based on a history of costs, which later in the agenda, I'll talk about our placement budget a little bit. And children's is at 2%, so we're good there. So knock on wood, we stay that way.
Yes. Any questions? Comments? 2027 Health and Human Services Proposed Budget Summary.
Should have brought something to drink. I should have brought my bottle of water. All right, so we'll start off here with the placement fund. So this was the proposal that was provided to the county administrator. We met last week, was it already? 2 weeks ago, last week. I don't remember. Yeah, it's a blur. So we met, we presented, so this is the placement fund budget that we proposed. We wanted, the request was to keep tax levy status quo. We didn't request additional levy in either of those accounts. It was requested that I do a 5-year comparison so we can kind of see that over the course of the last 5 years, the adult fund, we've stuck around that $700,000 mark. I think the average was actually $654,000 for the last 5 years. And so that's kind of where we came up with this number. And the same for the children's average for the last 5 years was about $634,000. But we did ask, but we were asked to reduce the levy in Fund 440 to $430,000, and then there's going to be a revenue line that's going to be added that will allow us to utilize some of the cash balance in that account. So, because as you can see, if we request levy in 1 year and then we have really low year, that kind of keeps that cash balance in a good spot. So we're kind of at a spot where we can tap into some of that. So, and I tried really hard to remember what that revenue line is going to be called, but that's okay. Yeah, so
Appropriation of fund balance.
appropriation.
It'll be a revenue line.
Thank you. So
So by keeping the levy at the same rate as 26, is that based on the expectation that the rates that we're paying locations will remain the same and the utilization will remain the same? Or is it kind of a hope that that's the case?
it's a hope that that's the case because I have no information. We start our contract outreach. Well, actually, we're going to start that here in the next month or so, but a lot of times these facilities, they don't even know what they're going to be charging next year. So I know Winnebago, I think we can probably anticipate an increase there. But we have had some facilities come in less, so I know.
I would find it helpful in the budgeting cycle to determine how many days of placement or how many individuals the levy would cover, just so that we can keep an eye in comparison to the utilization of that service over time. I don't know if that's realistic or even possible to do that.
I would say that's a very difficult task, considering one placement could be $150 a day and another placement could be $3,000.
Yeah, I just find a large dollar amount without measurement of how that would be utilized, just kind of shooting in the dark. And maybe that's how budgeting works in this area. I don't know.
I think it's based off trends. So we look at like how much we spend on average, because this is something that is completely out of our control. placement is completely out of our control. If somebody needs to be placed by the courts, there is nothing that Stephanie, Brittany, Tammy could do to
Yeah, and
adjust it. We can't say we don't have money, so we can't do it.
yeah, and I accept and
Yeah.
appreciate that dilemma that poses. I'm just concerned that, how will we know, other than the utilization of how fast that money is spent? Is, to me, it seems like there could be some measurements. To that. But there aren't.
Well, I guess that kind of leads into my question. So if a fund is hardly being utilized, it's at 2%. What happens to that money? Does it just roll over? Does it for the following year? None of it can be transferred into another fund.
It certainly,
Right.
Not without board approval.
right.
Board approval?
County board would have to approve to transfer
reappropriate.
between approved budgets and funds. So we'd have to write we've talked to Tammy Newberry about that for various other funds that, hey, because we wanted to create the United Givers Fund in its own separate fund. Well, in order to do that, take money from where it currently sits in 560, we would have to go to the board with that resolution and explain why we are moving those funds.
And we've done that.
And that has been done.
So it is possible, and that's kind of why, a couple of years ago, I think, we had talked to administration about, the ability to be able to keep those funds in there, because I want to say 10, 15 years ago, they just used to just take it, right? And then we would have to go at the end of the year and ask for $500,000 or $1 million. So this has been something that over the last couple of years, we've been able to kind of leave it in there, roll it over. And so like we found out when we were looking at the budget, that fund balance is in a good place so that we can go ahead and basically
So
ask for
this-
less levy this time around.
Yeah, you're gonna reduce your tax levy that you're looking for by like 200,000, because we're gonna take the snow previous, and you never know when one of those placements is gonna happen. As someone who has a brother who's in an adult family home, I just never know when he's gonna take a one-way trip to Winnebago for, a week or a month or whatever it might be, and that's very costly. That's why that money has to kind of stay and reside within that account, regardless if it's, I think you said it was around 80 people or so that were within that. I think adult family program when we spoke or whatever, that at any moment, like if all 80 suddenly
Oh,
needed
right.
the care, we could be in a world of hurt as the county if we don't have that money there. That's how it was explained to me.
I mean, we can definitely look at individuals versus days. It's a trend that way. It's really cost dependent on the facility. Any other questions about the placement budget?
Everybody okay? Cindy, you okay with that?
Yes, I am.
All right. Pine Valley.
Actually, can we talk about my
Absolutely.
other budget, my big one?
Your big-
Because I thought it was two parts on the report. Sorry about that, on the agenda. So I'm sorry, I didn't just roll into the other one.
Madam Chair,
Yes,
I will point out, I did accidentally swap the attachments. So 7D on the agenda is the proposed budget summary and 7E is the placement.
Oh, I see.
I had them incorrectly labeled in the packet. I can fix that.
Okay, so we'll flip back around. So yeah, if I could, we can jump to my
Sure.
budget summary. Sorry about that. That was me following the packet.
number D, letter D.
Yeah, so again, these are all of our other funds. We have 4 other major funds. And we took this budget proposal to and also submitted this to the county administrator. But we took into consideration everything that was put into the guidance document, objectives and guidance. So this includes 1.7 on the wage scale, 2.5% cost of living adjustment. An
Oh, yeah.
increase.
Thank
You got a
you.
little surprise when I walked over.
Well, usually it doesn't make a whole hell of a lot of difference.
There you go. Retirement, no changes in health insurance. It also, there was a request in the guidance about regarding positions, any new positions, any filling of vacancies had to be pre-approved by administrator, county board chair. So there are a couple of positions that are not budgeted for in this particular budget. And so what we did is we really just built it based on what's essential, what's our justified expenditures. We excluded anything non-essential. This really is our cost to continue, cost to keep staff. If I look at each individual line, administrative fund, you'll see that there was a reduction there. That is because there is one position there that was not approved to fill at this time. Public health, we had to do an increase in levy in that one. Again, just the cost of doing business, but we're also coming up on the cycle doing our CHIP and CHAW work, which is our community health needs assessment, community health assessment in our community health improvement plan. And that's coming up. It's going to be due. We're gonna have to start that work in 2027. And so I put a little funding in there, request to hopefully hire an entity to help us with that. ADRC, slight increase, but that's just normal increases. Elderly services, status quo with tax levy ask. Child and youth services, there is one less position in there that at this time. Behavioral health programs, there is a net increase in costs, so a little small increase, but that's CCS program, but that can be offset with Medicaid dollars. I think what might jump out at many of you, if you've taken a really deep dive look at this, is we did have an increase in our costs, but we did not ask for an increase in levy. That's because a lot of what we have, we're able to offset with, like the Medicaid increase, the CCS increase, offset with Medicaid, ADRC, we can offset that with drawing down additional federal dollars. So there's ways that we can offset that. So we didn't have to ask for more levy. So that's what we came in at with a 0 levy increase. And that's what's on what we presented this time. I did do something a little different this year. I did break out salary and fringe, what that cost would be compared to any other program expenses. And then under revenue, I kind of broke out a lot of what we get is the intergovernmental grants. As you can see, like in our Fund 560, that's almost $3.5 million that we'll be able to draw down through various funding sources, through DCF, THS, grants. Public charges for services, that's our health insurance reimbursements. So that would be where our Medicaid dollars would come in. So yeah. So we are requesting 9.58 million and only asking for just a little over 1 million in levy.
Madam Chair, I have a question.
Mhm.
On a scale of 1 to 5, how realistic do you think this budget is as far as the ability to stay within budget?
Scale of 1 to 5 to stay within budget. 1 being not good and 5 being super good. I would lean towards the 5.
That's good. I appreciate you taking a close eye at positions and ways to keep your levy constant. I appreciate that.
Stephanie, can I ask you another, what is the difference between having an RN on staff and the other?
Public health
option?
specialist.
Which one's the cheapest?
Which was the cheapest? Well, the public health specialist is cheaper.
Okay.
But the work that they can do is different.
I was gonna say, can they do everything that an RN could do?
Oh, no, they cannot. Brandy Anderson, I think she's online and she actually put her camera on, so.
Hi, this is Brandy.
Can
I'm
you
the
answer that question? What's the difference of the work that they can do, Brandy?
so statutorily, public health departments are required to have a nurse. It's part of our state statutes. We created the public health specialist position in 2023 because we weren't able to get nurse applicants. Because I have a bachelor's degree in nursing, I was able to fulfill the requirement of the public health nurse. The candidates that we hired as public health specialists in 2023, we actually, one of the candidates did have a master's master's in public health. He was not a nurse. Nurses are clinicians. Some of the work we do requires clinical nursing type of skills. For example, immunizations. Some of the case management we do for public health investigations requires clinical clinician type of skills that are not specific to a public health specialist or a generalist. They can do many other tasks to help with our public health workflow. But I feel right now it's really necessary to have another nurse on staff. Historically, we used to be a public health unit of 3 registered nurses. And we haven't had 3 nurses on staff since 2023.
Thank you. You're welcome.
Any other questions or comments? Do you have anything further to say?
Budget? I don't think so, unless you guys. Thank you.
All right. Pine Valley Community Village, letter F, administrative report, and then we'll do the financial.
So changed up the administration monthly report, just a little bit. So skilled nursing, we're about 65. I think by the end of the day, we'll be at 66. So we're at 81% of occupancy. Our current CVRF is 100% full. We've been impacted quite a bit by hospitalizations and deaths that have occurred. But obviously we anticipate those with those chronic health conditions. For clinical coffee, these are the things that we kind of go over during coffee, just so you guys can see all the things that we look at trends, we look at reports, we look at how to improve and what things. So this month's coffee that we had in July, we're going to continue infection prevention measures and control and education with staff. Ongoing into the disciplinary fall reviews for identifying trends and implementing individual interventions to reduce the fall risks. Next page is the survey update. Like I said, we received the 2 small sites in the health survey, and then life safety. We have a couple sites there as well. Both of those plan of corrections have been approved, and we are back in compliance. So we'll continue to manage the compliance through routine audits, staff educations, and quality assurance activities. Roof replacement started on Monday. They had all those hot days, so they kind of had to push out our start date, but they did start on Monday and they're almost done already. And it looks good. There was some problem areas. Obviously, we had some leaking into the building. And then we also got those vents put in to try to prevent that heat from getting too hot. I think when they measured it on Monday, when they started, it was a little over 200 degrees in the attic. So I think there's like 5 of them in just the one area that they started on Monday now. So that should help alleviate the stress on our systems in there and our sprinkling systems. Then trash removal, I changed the services over. Produced waste management, we were paying about $1,000 a month for waste, and with the new current company that we're using, it drops it down to about $550. So probably be saving about $6,000 annually just changing our trash services. Recruitment and retention, we're still hiring for RNs, LPN, certified nursing assistants, but we are able to maintain good continuity of care through the current agencies that we use, which is Clipboard, Grapetree, and Emergis. But we continue to actively recruit new staffing. For dietary services, we did implement a new workflow change. It's just designed to increase management presence within the kitchen. the idea is to improve quality control on those and then improve the oversight of the daily operations, just with those two health citations being in dietary. We just wanted to make sure that we got a good look at the operations and how to better manage that, especially with new hires coming in and things like that, just to make sure that they were comfortable. At one point, we might go back to the way things are, but it sounds like it's doing really well. Residents are happy with things. And we just want to make sure that we're more present for dietary staff. And then looking ahead, just we're going to continue with recruitment and retention. We have the fall Southwest Tech. We can go to that job fair, so we're getting signed up for that as well. Strengthening infection prevention practices. We just had an MDRO, which is pretty highly contagious, come into the building from a resident that's been in there. So obviously we need to definitely beef up and it's through no fault of our own. It's just a resistant, like a antibiotic resistant drugs that just came across. So making sure we're doing a lot of audits and things like that we're working on. We do have COVID in the building again, and mainly on the CBRF side. That's like a love-hate relationship at this point. Reducing the falls, making sure the roof is finished, operation improvements, and then maintaining compliance with state and federal regulatory requirements. Question? Yeah.
Did you say they're done with the roof?
Almost.
They did that whole complex in 4 days.
And they had one day off, so he's bringing about 25 men. So a lot of them shuck off everything and they start laying. They like literally are running on the roofs. Yeah. So yes, they're almost done. I did get some pictures that I can show you guys afterwards, but they're almost done.
Thanks.
I think they only have the assisted living side left. We just finished on the 400.
Have we had anybody look at it to make sure it's quality work?
Yes, so I've got pictures. He told me all the areas in which they were not good, and he does have a lot of verified work on. So I did do a lot of vetting before going with the roofing. But yeah, we can have somebody come out if that's what you prefer, but I think he's been vetted pretty well.
Sure. Good job on the reducing the cost of trash. Is that a contractual price for a period of time?
5 years.
Okay, good. And then with your nurse retention, are you measuring retention rates?
So a lot of it, when we meet with them, we try to do as much of an exit interview or ask questions of why they're leaving. While the benefits are really good for them, they're offered positions with a higher pay. Like a significantly higher. So we currently pay our RNs $34 an hour. When you've got Schmidt, Lafayette, you've got Stock, who are offering about $40 an hour for an RN. LPNs, they are offering about $32 an hour, and we're offering 27 or 28 per hour. And then CNAs, they're offering about 25 an hour, and we're at 21 or 22, I think it is. So a lot of it is that competitive wage, even though our benefits are really well.
Yeah, my question had to do with the retention rate, so that monitoring whether it's increasing or decreasing, is it an increasing problem or not? So rather than the reasons why people are leaving, what is the outcome of that?
I think we're pretty much steady.
Yeah,
I don't see like a significant increase with it. I can bring you the reports that we do through Quappy, like how many people are leaving versus how many we hire. I mean, we do that through Quappy for retention purposes, but I can bring those reports.
Yeah, I would suggest that be monitored so that you can track and know whether it's an increasing problem or a decreasing problem, so that actions or resources can be applied to address it.
Yep, I mean, we do that every month through Quappy. So our medical director and the whole IDT team, we talk about that, and it's percentaged out. So each month we look at that. So it's not something, we measure those and see if those are increasing, but it's been pretty steady. It's something that we hone in on during that because we want continuity of care. We definitely want our own staff. And like I said, like our HR person out there and nursing and I myself, we kind of really dig into like, is there something that can be done? But the reality of it is, I mean, as we're bringing them in, some of them are going out because.
And then my other question has to do with the vacant beds. And the expectation that something could occur perhaps to fill those beds, whether it can you transition from community-based into the skilled nursing? Are you able to put something else, a different type of need in that role? Or how would you go about increasing the occupancy rate?
So they have to have a reason, so they can't just come off the street and say, hey, I want to live here. They have to have a skilled need, so we have to be able to bill some sort of insurance or bill for private pay, but we have to submit MDSs every month that says this is what we're taking care of them for. For our CBRF, we can't change or interchange that. That's licensed as well as our SNF. So they're licensed for a purpose and we have to utilize those beds for that specific purpose. So we can't deviate the course of action because it's what we're licensed to do.
So if it was determined that this is a long-term census issue, where you have 100% occupancy on one and 80% in another, would need to go through relicensing of some space in order to change that.
We can't relicense a portion of a building.
So we could have a vacancy, get a vacant space in part of the building and be at capacity on another. And there's nothing we can do about it.
Correct. So the CBRF is licensed for an assisted living. So they have to be at an assisted living level to be down there. So we can't, I mean, we have taken and we bounce our residents back and forth
Based on their needs, right?
correct. So like, let's say somebody declines on the assisted living, we will transfer them, rehab them and send them back down to the assisted living.
Okay.
So it's a bounce back, but it has to be for a specific need. But if they're assisted living level, we can't technically keep them.
So in the past, how long has it taken to increase the occupancy in the skilled nursing facility when we've had a situation like this before?
I like to see, and mind you, this census is due to, we had, I think about 4 deaths in a week. So I like to see it in the 70s as much as we possibly can, but we also have to base it off our census and our acuity levels. So as long as we have the staffing, then we can increase our census. So it also goes based off of that, based off of our facility assessment. So that's something that state looks at when they walk into the building. Are we meeting our patient's acuity based off the appropriate staffing?
Yeah.
And I mean, our census is, I mean, we don't take a lot of high acuity. I mean, we have chest tubes, we have IVs, we do all those heavy cases, but there are very high limitations of what we can do based off of our staffing. We have to make sure there's more appropriate RN coverage in the building for high acuity patients and things like that.
So in the past, has this been kind of an issue?
When I first came in, the census was pretty significantly low. When I started, it was kind of like that for a little bit and then we started increasing, but typically it's not a huge issue. It's just usually after those, because death comes in 3s and 6s and stuff like that. It's usually like after that we struggle, and once we get up there, it's pretty good. But we have our limitations of what we should admit versus what we can admit.
Thank you.
Any other questions?
Yes.
Yes?
Do you currently offer either cardiac or physical or occupational rehabilitation?
Yeah, we have PT, OT, and speech. Cardiac, we can't do. That takes a specialized therapy, and our current therapy does not offer that. They do that directly through the hospital, but we do have a patient who's on cardiac rehab, and she goes up for her visits up there, but we do PT, OT, and speech, and we do swallow studies, and we do all those fun things in the
So-
building.
How does that impact your population, your employment, and your budget?
What do you mean?
Having the service, how does it?
Well, our therapy services are required, so we have to have some sort of therapy. We do outpatient, so people from the street can come do therapy at the building. So we offer that as well. But our Medicare patients, somebody that's coming in for rehab purposes, that is actually significant to our budget. It is a lot of our money. It's higher than our Medicaid patients. It is like a daily reimbursement of about $600 per day. when somebody's on those therapies. They're required to receive at least 5 days a week of therapy in order for Medicare to cover.
Anyone else? Okay. Now we'll go on to the Pine Valley Community Village Financial Report.
It'll be probably the financial review, the June year to date. Yeah. 7F4. There you go.
Kind of easier for me to read this way. In case anybody didn't know me, Leanna Pick, Finance Director for the county. I've been working kind of hand in hand with Pine Valley, helping them in some of their financial review, general ledger work, whatever they need assistance with. So working on the financials, what you have here is the year-to-date financial, showing you kind of month by month. Let's go through the revenue. It's telling you what the source of the revenue is. So you can see our biggest amount of revenue obviously comes from the Medicaid, skilled nursing. So if I follow that across, that's at like 2.9, and then followed by Medicare. So really heavy on the Medicaid and Medicare revenues coming in. Year to date, we're at 6.2 million in revenue. We trend at about that 900,000 to almost a little over $1 million each month. That seems in line with what I was reviewing for last year's revenues as well. In terms of expenses, so we got them. We got them in terms of their departments. So as we just mentioned, some about the various buckets we bring in. So activities, that's, help me if I'm wrong about this, but that's like social things that you do and whatnot for residents. So it's at like 76,000 for the year. You can see the trend lines going across. They stay pretty steady. And so I look for anything where it dipped for any reason, or, you know, if there's a spike in any sort of expenses. Obviously, the biggest category within the operating expenses is the nursing and understanding what's inside of that nursing. So when we go to the details, you have all the details by line item. So you'll be able to see kind of what makes up that 2.1 million, but that is all of your RNs, your LPNs, your CNAs, your nursing assistants for both the units, SNF and the CVRF are in that bucket. So it is a very large dollar amount that goes into there, a lot of it being salaries and benefit related. Then we drop down, we got medical supplies, we've got other purchase services. And the next biggest line that we have on there is the dietary, obviously providing 3 meals a day, 365 days a year to all of the residents. That ends up being a rather hefty number when you get to the end of the year as well. This report also includes depreciation, which is a non-cash expense, but still has to show up on your financials. So we've been able to get this now so that it runs through the system automatically. Which is kind of pushing a button, telling it to update. Poof, it does it. It was missing from our financial, not missing, but not there till the end of the year last year. When the auditors came in and asked us, well, how do you do this? And I'm like, I'm not sure how we do this in Matrix. So we figured that out for this year, and that's working fine within here. Stays pretty steady at 95,000 a year. Total operating expenses so far 5.4 million versus your revenue of 6.2. So we're sitting halfway through the year at about 800,000. If you added on that depreciation, which is a non-cash expense, then you're sitting at what, about a 1.3 million or so in actual revenue that's coming in through the facility and cash coming.
I have a question. So what happened between January and February? If you look at the bottom line net operating, it shows that there were some, is that underbooked in?
So that was the same question I have on there, because there is that negative. It's the twice a year we have some, what is that?
It's the interest expense related to the general obligation bonds debt that the county holds for Pine Valley. So this is where the interest part of that shows up. The principal part of it is a reduction, which you'll see on the balance sheet is where that sits and reduces the amount they have outstanding. And then they take in tax levy, which enough to cover that part of what they're paying in the principal for the county, essentially. Is what that covers.
So what was the situation in employee benefits between January and February, where January looks to be $100,000 less?
Yeah. There's the accruals that obviously go back to the prior year, and then there were some audit adjustments within the payroll and benefit accounts where things last year at the beginning of 2025 weren't booked correctly, so there were some adjustments made there. So that's why that swing is in there.
Like unpaid salaries or something like that?
No, it was just miscodings and things that they reclassed. So instead of it being in that line, then it's up within the nursing and the departments in which it belongs in. And everybody's benefits go through there. That stood out to me too, but that's why I went and looked at it and knew that it was the audit adjustments and these other changes that we made in our. But it is accurate. It does tie to Tyler in the financial statements that are within the Tyler system. So this one comes out of Matrix because the only way to really get the details for Pine Valley is to get the report out of Matrix. Because otherwise within Tyler, all you're gonna get out of Tyler for details is your payroll benefits. And everything goes into a line called bills, no line detail. And nobody likes that. I know everybody loves the details, so that's where we're gonna get to next. So please scroll down to the next section. All right, this is where you really get to see each portion of what made up the revenues, you know, the contractual adjustments that are done, all the equipment, everything within these revenues that's kind of in and out. Contractual adjustments are interesting because I did do a little simple math on them this morning on the Medicare and Medicaid, just to see if it was kind of in line with some of the other discussions we've had about contractual adjustments, write-offs, whatever you want to call them. And they actually are. So they run about 28 to 38% within these categories as well in terms of your contractual adjustments. The amount that comes right off the top from Medicare, Medicaid just says, we're not going to pay that. You might have billed it, but we're not paying it. So that exists here within their financial statements too. So just wanted to kind of point that out.
What percent was that?
Within the Medicare, I believe it was 28%. Hold on, I have it up in my spreadsheet here. Yeah, so within the Medicare Part A, it was 28%. And then within the Medicare Advantage, it was 38%. And then those were kind of the two I hit this morning. So the two big ones. So they kind of fall within that range that we've talked about, anywhere from, 25 to 50%, depending on the person or the billing.
And then what's reduction 2%?
That one, I'm not 100% sure on. I will say that. Do you know anything about that one? That might be a question for Haley that works on these regularly. It might just be a discount or something that we give based on timely payments. Not sure. Can you ping her maybe and see? Okay. Yeah, we'll get an answer on that. Okay, so these are the revenues going down. So you can just scroll down for a while. You can see what each portion kind of brings in, contractual adjustments, where they end in terms of revenue. And it all ties to that first summary that I showed you. And then we start going through the details of the various sections, whether it's the activities section, the social services. You can just kind of see every detail that's in here, and a lot of it, when you get to that big one for nursing, you can see a lot of it is heavily within the wages and the benefits, obviously, and anything that we're doing, those are really your big line items. And then if you get towards the bottom of that, it gives you the expenses that are specifically associated with them. With the account breakdowns in here, when you see the 63, what I did for some other reporting that we do for Medicaid and Medicare cost reporting is that I broke that. So where it says like 63120 63-00 there for CNA holiday, and you see those 63, you see 6A, 6B, 6C. Those are breaking those out by category. So it's CNAs, RNAs, LPNs, assisted living. We can break it down, summarize it, and see it by those groups then. Because otherwise nursing's so large to break that apart for these reports was really difficult for us 2025. So now this should make it a lot easier going forward for our Medicaid and Medicare cost report.
So I did reach out. So it was part of Medicare's budget cuts. It's a sequestration of payment reduction and it's the across the board federal budget cut of 2% that applies to Medicare fee for service claims. So it's just a way to say that they were cutting their budget and they're making us lose 2% so that we get our claims paid.
Thank you.
And so, yeah, you can just, again, you can see the month over month, details within any one of these categories, any accounts, and they're gonna read through every line, but this is gonna give you what's behind the numbers. So if you have any questions, just feel free to reach out to myself or Brittany and we can dig further into those and give you an explanation of those line items.
So when I was looking at the monthly financial reports, I saw that there's some payments made that look like they're made to individual names. Rather, is that people who are paid directly but not part of a service? Or what is that? So like there's a name of Sarah.
That is our registered dietitian, Sarah Sardini. Yeah, that is our registered dietitian. We're required to have a registered dietitian.
She's not considered to be an employee.
Nope, because she's considered contract. She's not an actual employee, correct?
Okay, and so she doesn't work through a service. It's a one-on-one contract. That person.
Correct.
Okay. Is that common to do that?
Yeah, most places is you contract with a registered dietitian because they're only usually giving just so many hours. So she gives us like 16 hours a week. But because she works in multiple facilities, so she works with Schmidt, she works with, I think, Darlington or something like that.
Thank you. And then the interest expense, how often does that happen?
It happens in March and then one more will be coming up in September this year, at the beginning of September.
Okay, and
So-
then so that would be interest on the debt, right? And then we make principal payments of the debt
We
also?
make principal payment once a year in March, so that's the only principal payment that goes out, but we pay interest twice a year.
And where do we see the principal payment?
The principal will be on the balance sheets, the reduction of the principal that's on. That's
Okay,
within
all
my
right.
report here too. So as we go down, we can see the breakout within the employee benefits. So I will take another pass at that just because again, here it looks like there is a little bit of can't see it on there. A little bit of a dip in the health insurance, which I think might have been reclassed to the previous period, depending on what payroll that comes out of. They can't have it in both places. So that looks to be the gap that you see. Then says interest payment and the depreciation, it breaks it down by category. And then bottom line is the 804. I included claim on cash just so we can kind of look at where we're at in cash position. So to keep going, that should be the next one after the financials. Going one more page maybe. There we go. Claim on cash. So this is essentially the checkbook for Pine Valley. So you can see kind of what our beginning balance was in January, pretty hefty at 5 million in cash, which I've mentioned that before, that we have a pretty good cash balance within Pine Valley. Some of that, 1 million of that is reserved for capital improvement projects, and another, 700,000 so is always set aside for the principal tax levy and stuff, or the debt payment, which goes hand in hand with that tax levy amount. Cashiering that you see here is just the incoming revenues, the incoming cash flow that they have, deposits. Obviously, accounts payable is pretty self-explanatory, payroll self-explanatory. And then off to the side, I have just a little breakdown of some of the bigger journal entries that happen. So there are journal entries. The only one that comes through there for benefit related is our HRA and our FSA. Because there's fees associated with that don't run through like the payroll packets and stuff. They still go via journal entry. Everything else goes through the payroll packet. So you see that there was a reclass from ambulance to Pine Valley of 54,000 that was miscoded as being ambulance, incoming cash, but it was actually related to Pine Valley, so that happened in January. And then you have the 737, that's a part of that general ledger there in February, that's the tax levy being distributed to them. And then March, you see the general ledger there, that's the debt service. That's your principal and interest going out of their cash there for Pine Valley. And then that gets us to where we are today, sitting at 5.7 million in cash right now in the checkbook. Any questions on that? Pretty, like I said, pretty healthy cash balance at Pine Valley. So as long as we kind of stay in that positive revenue category, we're gonna stay ahead of that. I included, because some people are visual people, year over year revenue and expenses. So this one is quite telling, honestly, going hand in hand with the what we talked about the census and the beds. So if we were to bring in the census numbers, I think you're gonna see a similar trend line to what you see here. The blue line being your revenues, the orange line being your expenses. So you can see for 2020 through 2024, really, we were not winning very much there. We were kind of losing money a little bit with our expenses exceeding our revenues. We get to 2025, those are almost neck and neck. Like we're closing that gap. And then here we are in 2026, year to date, sitting on that healthy, 800,000. If you added your depreciation, obviously you're sitting on that 1.3 million in revenue year to date. Double it up, that's probably where you're gonna end the year, pretty close to that.
But I agree with your statement about the census numbers overlaid on here. Would
Yeah.
probably be pretty telling.
I think it would explain the story even more. So if we can pull those or an average of those per year and lay those on here, I think you're gonna see it's following a very similar trend. So
Which is concerning now, in the position that we're at 81%.
a little bit, but explain through, the deaths, if we can get those back and get those numbers up, which I'm sure that we can do that.
A lot of it bases around what we're able to build. So even if we have 80%, 90, 100% of residents, if we don't have enough to bill on, we're not going to earn a significant amount of income. So we are very fortunate to have Rachel, which is our MDS coordinator, who is able to focus on all the things that we do, whether that be IVs or finding somebody who got pneumonia or needs or is put on antibiotics, capturing those significant changes, really adjust how we get income. So our stuff is based off of PDPM. So if we took a bunch of easy patients, we're not really getting a reimbursement high enough. So it's really what our staff do with making sure we're capturing those things. So
Are we able to shrink expenses
I have been doing a lot of
at
expense
the same
shrinking.
time to align with the census?
Yeah, I've been doing a lot of shrinking. I've been changing a lot of things to make sense. There was a lot of things that did not make sense when I first started. We had 2 fire services, which we now combined into one. Food services, we're even currently looking at like where we receive our incontinent products, how we're receiving those. So that's something that we're looking into. There's a lot of things that since I've started, we've adjusted or kind of went somewhere more reasonable, I think is the biggest thing.
Are nursing expenses scalable to align with census?
Yes.
Anything else? Anybody online have any questions or comments?
And we did like one more at the balance sheet, which is next, just a quick look at that for June. Again, kind of there's that cash position you're mentioning, the trust funds are in there, there's your accounts receivable, which that's cash coming, that's gonna be coming in. We know we're gonna collect a portion of that and bring that in, adding to our cash flow, so it just sits in your asset list, because it is an asset that can be converted to cash in the future. Inventories in here, prepaid expenses related to all of our insurances, which we divide that out. Some of it happens at the beginning of the year, some of it in the second half of the year, so that will change as we go into the second half of the year. That'll be distributed into the expense line. You can see your total of your fixed assets. We have 11.8 million in total fixed assets, building equipment, upgrades, things that we've done that go within that category. Other assets, that one I gotta dig into just a little bit more. I'm not sure exactly what's in that pool. So these are assets, and then go down to our liabilities. So this is where you have your current piece of your liability and your other liabilities, which are your long-term debt, and everything is falling within that long-term liabilities, and a portion was in the current liabilities, and then some of that is payables as well, depending on when the report is run. And then there's that other liabilities category too, which again, these others, I'll have to just take another look at those to see what's within those, but I don't see anything that's really been too concerning. Your equity is, 4.3, you're gonna add another, right now, adding 800,000 to it, sitting at about 5.1 in equity. So as we discussed earlier, in terms of like, what Stephanie was doing with, HHS and using some of that fund balance, we have that available here too as well in terms of equity if we needed it. But right now, there's a steady enough cash flow within Pine Valley that I don't think we have to really touch that. So depending on what all happens, we can't all see the future, but whatever happens, then this all gets settled at the end of the day. Settled out. Any questions on that? Then I can get answers for you on the others the next time that we meet here so that I know what's in there on their books.
Thank you for the explanation on the financials. It's helpful.
How frequently do you see this?
Well, we can ask for it. What do you suggest? I mean, does it change?
Quarterly is probably
Quarterly?
fine. Yeah, we can keep up on it then. We can see trends. If anything is concerning to us, then yeah, I think quarterly is a good judge of that.
Is that quarterly?
Or bi-monthly.
Any questions or comments? Thank you for everything, because that really clears up one of the.
Very helpful.
Questions, yeah. You're welcome. I am gonna bug out here though, because I gotta get back to working on budget, so. Excuse me. Back to the next task, so thank you for allowing me to speak.
Oh, thank you.
You're welcome.
Yeah, I'll take you a seat. Thank you.
We're moving to 7G, Child Support Agency Directors Report and Departmental Activities.
All right, good morning.
Good morning.
All right, so in your packet, we got our lovely little color coded performance measures. Everything that I'm showing you today is end dated June 30th. So paternity establishment, we continue to rock and roll on that. Court order establishment, we're trending around 93%, which is great because the benchmark is 80. That means that 93% of our open cases, we have established court orders for. The other 7%, we are usually actively working on with the goal of getting a court order. Collection of child support, we are still under that 80% benchmark. Statewide, we continue to ride the struggle bus with this. There's only about maybe 25% of counties who are able to hit the benchmark right now. We have been trending slightly upward, so that's good. In fact, this has been such a topic because the state average right now is 73.39%. And that I'm attending an upcoming leadership meeting the end of this month. That is one of the main topics we will be addressing. And then at our child support conference, we actually have multiple sessions where we will be discussing this topic because so many counties are struggling with this one right now. And then arrears collection, that's one that resets every year on October 1st. And we start at 0 and we work our way up to hit that 80% benchmark. At the end of June, we were at 85.63%. We are actually 5th in the state for collecting past due support balances. So I am very happy with that.
Way to go.
So if they can just pay their current support, then that'd be lovely. As far as staff, we did hire our clerical assistant, Courtney Mahan. She started in May. That's a part-time, non-benefit eligible position. She's working about 15 to 20 hours a week. She did complete all of her required online training, and now she's doing her one-on-one training. She'll spend part of the time with myself and then part of the time with Charlene, the other caseworker. Our goal is to have her kind of up and feeling confident of working on her own by October, when Charlene and I attend the conference, so that she can man the office in our absence. As you guys all know, Amy Forehand was appointed district attorney, which as soon as she was sworn in, she was effectively no longer our child support attorney. HHS is in the same boat. So we had to reach out to Corporation Counsel, Russell Law Office. Part of their contract with the county is that they are to provide us child support services in the event that we need it. So Attorney Aaron Wolf has been assigned as our attorney. He had his first court cases with us a week after he was told he was going to be our attorney. So him and I have a phone conference every Friday where we just discuss things. He got access to our programs for e-filing and document generation, and we've been working out the kinks, but so far so good. It's been going well. It's a learning curve for both of us because Amy was the child support attorney for 24 years. So kind of had to pivot a little. For the budget recap, again, this is as of June 30th. We're sitting good for our expenditures. We have 56.71% remaining, so we're above that 50% mark where you want to be. And then we only I do claims monthly, but we only receive payments quarterly. So for the end of Q2, we don't receive that payment until the following month. We did receive it on the last day of July, and it was, so it will not reflect in this budget report, but it was $61,549 change, which means that we have received about 73% of our projected revenue for the year. And then I have been having meetings with Administrator Clements and Leanna, the finance director. The first one was on July 29th. We've had a couple subsequently, more to discuss. Attorney Wolf coming on board and how that would look. So budget is still being tweaked a little bit, and some of it is just due to we don't know when the new assistant district attorney is going to be hired and if they are going to take on the responsibility of being our child support attorney, because they're not required to. It's an additional thing that they take on. But for the time being, we do have a what's called a cooperative agreement, which is a form of a service contract with Russell Law Office to provide child support attorney services to us. Those will be included in our budget moving forward. Unfortunately, we didn't budget for that money. So in the expenditure part, you will see it in future budget reports as a negative number. Those are 100% reimbursable through federal dollars. So every dollar that we spend on attorney fees will come back to us in our revenue line item to offset it.
Is there a lag with that?
So again, they're gonna bill us every month, but then we will only get reimbursed every quarter. So since they started in July, we'll claim a full quarter, and then in October, we'll get all of that reimbursed for that full quarter back to us. So, and then the annual child support conference is going to be in mid-October. It is a 3-day conference. This year will be held up in the Dells. And so Charlene and I will both be attending that. And then the last bit, which is not on here because I just got it. August is Child Support Awareness Month. Governor Evers issued a proclamation. He recognizes parents and caregivers who are supporting their children and their children's futures, and the child support professionals who are serving them. So I think that's wonderful that the state recognizes the the hard work that our agencies put into, and also the parents and caregivers that are taking care of the children we support. So if you guys have any questions, I would love to answer.
Any questions or comments? Anyone online? Great, none. Thank you.
Thank you.
That was very nice. We are moving on to number 8. Discussion and possible action. Process for acquiring providers and bids for contracts.
Sure. So, last month there were some questions about, primarily around, competitive bidding for some of our contracts, that you would see on our contract monitor report. So I did some checking on that, and I confirmed with our the county's procurement policy that a competitive bidding is not required for professional services contracts. But there is protocols in place to make sure that we're considering qualifications, all the things. We follow statute in with respect to that. So basically, when someone contacts us because they're interested in becoming a service provider, we ensure that all these criteria are met, that they have the correct licensing, they have their liability insurances are all up to date, that they complete credentialing as required by our programs. I really kind of did focus in on the CCS providers because that is the bulk of our contracts. But it's the same for BERT to 3, CLTS. Well, CLTS actually, we don't contract with CLTS providers anymore. That's through the state, but same kind of thing, right? We can't limit options for these families and individuals. They have to be provided with choices. So that's where our case managers come in, if they just discover that there's a service that's needed for a particular child, then they'll sit down and go over all these different options with them. So, so that's why these aren't put through the competitive bidding process. Now, with that said, I wanted to point out that there have been times when we have done bidding, right? A few years ago, we needed to change our meal provider for our meal site. So we did a bidding process at that point. But in the meantime, we're keeping an eye on that contract and to keep that where it needs to be. So there are occasions where we do bidding, but it's like, these are one-offs. So, so yeah, that's.
So I have a question.
Mhm.
Okay, I appreciate
Yeah.
you providing the explanation of how that
Yeah.
works. It's really
Mhm.
helpful. And so while it's not competitively bid, how do we ensure that the rates are reasonable and it's not just the sky's the limit, whatever you want to charge is what will be paid? How's that addressed?
So how that's addressed? So, so like for the CCS providers, right? So they're asked to actually complete what's called a rate sheet. And in this rate sheet, they have to list all of their expenses for their costs of doing business. So the cost can include like salaries or, trainings and supplies and those kinds of things. And they have to fill that all in the rate sheet. And then it spits out the number that like the cost per hour that we would pay them. And then this rate sheet is actually reviewed for reasonableness by what's called the Wisconsin Rivers Collaborative. So we're a part of this 3-county consortium with Sauk and Columbia. This rate sheet is submitted. We all kind of look it all over. We kind of say, okay, what is this, right? Why is this in here? This is not reasonable. And we review it and we go back and forth. And if we think that it's sky's the limit, if we think it's a number that's just out there, then we wouldn't contract with them. So yeah, so that's kind of how we do that, but yeah. Thank you. Yeah, you're welcome. Thank you.
Any other questions or comments? All right. Discussion and possible action. Need to approve a new transportation coordinating committee member.
Yes, so we have on our transportation coordinating committee, we have different providers that are a part of that. So BARC is one of the entities that we generally try to have on our coordinating committee because we do partner with them for different transportation things. The individual before Jesse Nelson had resigned, and so we asked for them to give us a suggestion. And so Lana Towsley is interested in replacing him. So she was approved at the last Transportation Coordinating Committee to approve or to succeed him.
Any comments or questions?
And I move to approve the school transportation coordinating member Lana Taus.
I have a second. All in favor, please say aye. Aye. All opposed? Hearing none. So Lana, is that how you say her name? So Miss Lana Towsley. Transportation. All right. Number 10, discussion possible action. Approve application and acceptance of medication assisted treatment in a jail setting grant.
So this is a report out. Actually, there's no action needed. Grant applications, as long as they don't require matching funds, in-kind match or adding personnel. It doesn't need to go beyond Trish's, the county administrator's approval, but I definitely wanted to keep you guys in the loop on some of the revenue sources that we're trying to tap into to do the work of health and human services. So this particular grant is actually if individuals are in jail, they can be assessed to see if they're eligible for this non-narcotic, non-addictive injection. We have staff that will go into the jail, they'll assess somebody, then they will get in touch with the jail nurse to get this all set up. And so this $98,142 is to help offset some of the salary costs for that, to pay for the injections, obviously, which aren't cheap. And so that's what this grant is. It runs July to June. So this is just letting you know that we did apply for this grant. It's actually a 5-year grant cycle. And I believe this 26-27 will be the 4th year of the cycle. So, so this was just a report out on that. But you know, we've done that. So, and we haven't heard back yet. Because we're in the cycle, I don't see any concern with that not getting approved or whatever. Any questions about the grant or?
Any comments or anything? Hearing none. Number 11, discussion and possible action to approve the application and acceptance of the state opioid response SOR grant.
So this is similar to the MAC grant. This is also a grant. There's no matching funds, no in-kind. You don't have to add personnel. This funding is, the state has opioid funding, and this is a grant that they give counties every year. If we submit that we want it and we say, yes, we want it. And it helps, again, it helps offset our substance abuse counselor's salary fringe. And we can use it to do other activities. We can even use a little bit of it to offset if we need, somebody needs residential services or those kinds of things. That outpatient counseling, right, for the most part, is what it helps offset the cost. So this is just a report out letting you know that we did apply for this as well to continue to do what we do. So any questions?
Any comments?
We want money. We like money.
When do you expect to hear whether or not these grants have been accepted?
Oh, sometimes it takes a month, sometimes it takes 3 months. And then we're usually a couple months in, but this application's due in September, so we'll probably hear that it's approved by the end of the year. Probably.
And would these be funds for 27 for the current year?
They'll start in 26 and go into 27,
So will we wait until we receive notice before we start incurring expenses?
no.
We get this every year.
We do this every year. It's every year. Yeah, I know. I get nervous. I do when we get to September, and so we do because we have a staff person in that position. So we do. So, but that's why we're constantly emailing the state. So what do we know? What do we know? What do we know?
This is the state, so, yeah, things move a little slow. Number 11, discussion and possible action. Approve the application and acceptance of the state dog survey. We already did that. So. You've already put this in, you said? Okay, we're on to number 12. Discussion and possible action. Approve the application and acceptance of the 2027 5310 operating grant and 5310 capital purchase grant.
So each year we apply for a 5310 funding. It's a federal grant that helps to offset the cost, our operating costs, to be able to provide our bus program and do wheelchair transportation. So each year we submit that. We have gotten that, actually we've done it 13 years in a row. We generally are pretty successful with that because we are such a rural community and we have very few transportation options for community members. So what it does is we can use, it provides the ability for us to have bus drivers and do wheelchair transportation. We do bus routes going out to numerous different communities, bringing people back into Richland Center to be able to do their shopping and personal business, medical appointments. We go out to other communities as well and take people to like to Reedsburg and Baroque, things like that. So as far as match for the grant, we can utilize our 8521 grant, which is state funding. That's our transportation grant that we get each year. So we don't have to put any actual tax levy match into that program. So we're able to utilize that and also our revenues from managed care organizations. So by applying for this grant, we usually are able to leverage up to about $30,000 to $35,000 in extra funding to be able to help support that program and provide those services. And then the second part of it is with our vehicles, our accessible vehicles, the 5310 capital purchase program is a program that we're able to apply for vehicles that we need. And so generally we try to replace vehicles that are at least 5 years old and around 100,000 miles. That is what is considered the useful life of a vehicle through the state of Wisconsin. And so we actually have 2 vehicles that are at the over that 5-year mark, but the one the mileage isn't close to 100,000 miles, so we won't apply for one for that for a couple of years. However, our minivan is getting close to 100,000 miles and is over 5 years old. So with that grant, our county match, we have actually a transportation trust fund. In that transportation trust fund is money from previous years of unused grant dollars or revenues. That has to go into a trust fund that can only be utilized for transportation purposes through the program. So any county match that we have to purchase the vehicle, which is just over $16,000, comes from that trust fund. So there's no actual tax levy going into purchasing the vehicle. With this program too, and I was just talking to Brittany before the meeting, we also do the grant for Pine Valley vehicles as well. And so we work closely with them in the past to be able to utilize the same program. So that way they don't have to spend $60,000, $80,000, $100,000 on a vehicle. They just have to pay the 20%. So those are things that we can do in the future for that program.
Any questions?
So does this program cover the driver expenses that we see?
So that's a 8521 program. So that's the state driver escort program. So those driver expenses that you see are volunteer drivers. So we get $79,889 from the state. We do have a required 20% match. That is can only be utilized by county governments and municipalities. So it's not a competitive process. We are just allocated, as long as you apply, you get that 79,000. And that's been the same since I started as manager in 2015. That hasn't changed. But then we also get a lot of revenue. So we contract with managed care organizations. So family care organizations that pay 100% plus of the cost of trips. And then we also passenger revenue as well. So we generally do not have anything more than our required tax levy match of $15,978.
So the people that are driving, do we require certain training and insurance or anything like that?
Yeah. So they do have to have full coverage insurance that meets the state requirements. We do a lot of different trainings, so they get confidentiality training, they get dealing with different passengers, they get dementia-friendly training, they get basic first aid training, defensive driving training. So we do yearly trainings and ongoing trainings with people for that. We also do, when somebody comes in, we do an interview process with them, our transportation coordinator and myself. And then we have a volunteer driver handbook that they have to follow. So they go through a lot of trainings because they do receive payments and then they turn them into our front desk. So there's a lot of different things that they have to meet. We also, we make sure that their vehicles are well maintained. So they have to turn in their maintenance records. They have to we do a driver abstract on them yearly. It's required every 3 years. I check their driving record every year. We also have to check them. They have to do a caregiver background check to make sure that there's nothing in that. We do a sex offender check. They also do an OIG, so it's Office of the Inspector General. I do that yearly. That's also required every 3 years, but it's free, it's simple. So I just check, and that then can tell us if there's any issues, if they have any licensures out there that have been revoked. So we check all of those things. I've got a list of about 12 different things that
Sounds like a thorough check.
we do. Yeah, we just actually had our federal audit. And so we had one little form that we needed to do and turned that in. And so that's a pretty intensive audit that we have to do every 5 years. And we had no issues with that. That went really, really well. So that is the second one that I've done now, and was really nervous the first time. They're super helpful, but we did really well the first time as well. And then we also have our vehicles that are, we go through all the same checks with our drivers for our paid drivers as well. And then, we have to meet all of these federal requirements for making sure we have policies in place, and that we are maintaining our vehicles. It's very cumbersome, but not hard, but there's a lot to it.
Thank you.
Yeah.
Mr. Barrett?
This vehicle purchase, is that replacing a current vehicle?
It would be replacing our minivan. So
What do you do with that van?
So with the minivan, then we would put it out to auction.
And then can that money be put back in the fund?
It goes
Whatever.
back, yep, goes back into the fund. If it's over $5,000, then we first have to notify DOT, and then they can recoup money from the grant that was given. So then we would only get 5,000. The last time I think that we sold vehicles, we got just over 6,000. They said, don't worry about it. Sent me an email and said, it's way more work for us to take that money than what it is for you just to keep it. So I said, okay, we'll keep it, use it for our next one then. Yeah.
Didn't know the state would cooperate like that.
DOT is really good to work with.
Stephanie, where did you come up with 100,000 miles? Cause these new vehicles. Really.
That is a state, that's a DOT.
That's the state
Mhm.
requirement.
They recommend, 5 years and 100,000 miles.
Probably it is, but actually working, hopefully diesels, especially 400,000 miles.
We don't have diesel vehicles and they're smaller vehicles, but they start, after they get to that 100,000 miles, they do start to nickel and dime you. Our previous vehicle, we kept a lot longer than that, and the cost for maintenance and for repairs was astronomical. We actually, our vehicle today, we just had our state inspection today for the State Patrol comes out and has to inspect our vehicles yearly. And we just had actually Pine Valley just had theirs today too.
They passed.
Yeah, they passed. Ours passed, but we have to get the tailpipe up towards the manifold. It is rusted through. So we are gonna have to replace that. That's gonna be costly. So
It's kind of the tipping point between having things start to go along with it and then your operating expense. No, but I drive Toyota and I got 230,000 miles. Nothing, because they were in.
yeah, so
Good luck on the way home tonight. Not you bring.
So it just, and because we are transporting people and vulnerable individuals, we have to make sure that the vehicles that we have are you know, in good repair and that they're safe. And we also are actually gonna apply for a bariatric vehicle because there are no services in the area that provide those bariatric trips. And we get a lot of requests and we have to turn people down. The one thing about our program is then when we do this grant process for the vehicle, I have to reach out to other entities to see, can you provide the service in Richland County? And can you do it cheaper? You know, what are you able to provide? I reached out to Town Taxi. They said only within Richland Center. We do a little bit outside Richland Center. We can't do what you do. Reached out to RC Transit, same thing. I sent them a letter. They said the same thing. We go within 1 mile. We don't go out to the more rural parts of the county. Reached out to Cooley Cap, same thing. You know, we're not in their service area. So then the cost, if they come to do a bariatric trip, is really, really high for people in our community if they have the ability to do it. And we have a lot more people that are needing bariatric.
Chair, I move to approve the Richland County Transportation Program.
Second.
Any further discussion? Hearing none, all those in favor, please say aye. Aye. All those
Aye.
opposed? It's approved, moved on to county board. Okay. Item 13, discussion and possible action, private pay rate increases for the SNF CBRF. Say what goes on.
Skilled nursing facility and this is the facility. So we have private pay who maybe don't have Medicaid or have the private funds to pay for their stay at Pine Valley. Each year we look at like the cost of caring for residents, the increase that it costs to take care of residents in the building, and that goes for both sides. You know, I think here all those personal items that we provide in the building tends to increase and creep up every year. So we like to stay ahead of that. For the skilled nursing side, it is looking like last year, the previous year, we increased it by $10 per day, and that is going to be the same request for this coming up year is the increase of $10 per day. We also do what's called respite care, which is where residents can come in for a short amount of time, like who have dementia or have some sort of issue or family members are unable to care for them due to a surgery or they're leaving town. We have those respite days available for them, and that would increase as well by $10 per day. The community-based residential facility. So we have what's called level of cares. So we have your basic, your enhanced, your advanced services per month. Each year we stick around the 3% increase. So you can see what the previous month, our previous year was and what this year would look like, as well as the respite care down on the wing is again going to be a $10 increase per day.
Should we get this on the table for discussion?
You make the motion.
Yeah.
Okay. Do I have a second to that?
I'll second.
Hey, now we can have questions, discussion.
Yeah, so the analysis that was done to recommend this increase. I'm questioning whether or not the consumer price index was taken into consideration, because the increases that are recommended are just slightly over 2%. It's CPI. It's well over 3%, 3.5. Was adequate to stay even expense. To me, it seems like it should be adequate to at least stay
Even, so what are you recommending?
that we consider CPI and setting this rate, because depending upon which category you're at, it should be more than $10.
This is a per day increase, so it comes out to about an additional $1,200 a month. And they're currently paying $360 or $350 per day as it is. So this would increase it to $360. This is the market around us. Most places do a $10 increase. Schmidt is only doing it $10. So we base it off of the people around us to stay within those competitive rates. Otherwise, we will start losing to other facilities.
Yeah, that very well may be the case, but we're not staying current with inflation. So our expenses will exceed the revenue increase. That's my point.
Chair,
Yes.
who did you recognize for second? Cindy and
Sure, yeah, Supervisor Welty made the motion. Cindy Checker. I understand that, but I also like if Schmidt and Harvest Guest Home and our house, we will start losing patients and in turn start losing revenue.
So last year, like I said, we did increase it by this exact amount, for anticipation, and we are ahead in revenues quite significantly. I feel like this particular, and keeping it that way, I don't feel will impact us as much as we would like to think. I think that we should be fine based off of what we did for the budget, what we thought the income would be based off of our census and where we're gonna keep our census. So a part of that, we are looking at over $12 million of income regardless, is what our anticipated revenue next year is going to be, if not more.
And you know, when I was out there with the donkeys, some residents were already mumbling about the rate increase about. So we're kind of between a rock and a hard place here. Because I'm afraid we would lose patients. Families will move now. So,
Can I say something?
sure.
I think one thing to remember too is that when people are private pay, once they are out of their money, they switch to Medicaid, which is a significant loss for the facility as well. So looking just at how much money they're spending for that private pay could also then push them faster into Medicaid, which is a much lower reimbursement rate. Right? Sorry for chiming in.
Is there is that including the private pay too, or are you using Medicare?
So it would include the private pay if we increased it the way we did.
At the same level.
Correct.
Okay.
So what we currently, so it includes all what my anticipated census, and even at a census of 66 is, I think, just kind of what I budgeted for, just to be pleasantly surprised at the end of the year. But also those realistic dips that happen in our census, we'd be looking at still over a $12 million income or revenue source, as well as our expenses with the new changes. So
I get a call, I got a call up. If they up things, they always do it to private pay. But it's at the same level for everything.
correct.
Okay, I was right.
Mhm. Correct. So the goal was to kind of keep it even and keep it within the market. So, you know, like our social workers tend to call other facilities and see what their private rates are and what they're planning to increase. And that's kind of how we base the number off of to remain competitive, but also have an increase of income to offset some of those balances. Medicare, like next year, we will get a percentage of what Medicaid will increase to, and it's usually like a 2% increase of what we get from Medicaid as well as Medicare. So if their percentage increases aren't significant, but they're enough to offset a lot of those.
Do you know when the other facilities are going to?
This is for 2027, and they do the same thing. So they plan for the next year. We just have to do it a little because it has to go through the board. I'm doing it now because we have to give at least a 60-day notice of those increases.
So be looking for Schmidt. Those as well. Increase.
Sure, I have another.
Yes.
question. So if we go to the rate sheet, then it's not all the same. $10 is much more significant in the lower end of charges, like under the respite care daily rate, going from 190 to 200. It's actually a 5% increase. Where in the other costs, it's between 2 and 3%.
So yes, like The monthly rate for the CVRF is a 3% increase. It's like that every year. They have not changed it, I think, for the last, when I look back at Pine Valley's rate changes, it's been a maintained of a 3%. Because our private pay in the SNF is billed at a daily amount versus a monthly amount that the CVRF, they do it based off the daily rate, and that's how all SNFs do it. They'll ask for what that private paid daily rate is versus what it's gonna cost a month. And we're technically a little bit lower than those SNF, like the Medicare. So Medicare can reimburse anywhere from 500 and some odd dollars per day due to additional resources, but then we can bill those private pays part fees for insurance or for like therapies on top of that. So it kind of evens out.
Yeah, my point is though, if we're trying to keep it within a certain percentage increase, recognizing that we're not covering the cost of inflation, it's a significant more charge for the respite care daily rate. It's 5%. That's my point.
It's a $10 increase across the board for like the respite on the SNF side and the CVRF. So I mean, just following what they did in the previous years.
Our family has been involved with another family member at a nursing facility. And I know what you're talking about, Shirley, but we've written the checks every month. And yes, it could have an effect on the population if we raise it too much, because it can devastate an estate in a year or two. Just drain it.
It is.
And there's no, I'm not being critical. It just costs that much to take care of something, but I would caution raising it too much. I think the recommendation is good.
My point is more around the inconsistency of the increase based on those different
I understand.
classifications of care. That's where my concern
Right.
is.
I
And the
understand.
concern
Sure,
about
but-
covering
but
costs.
it's- sometimes you just have to bite the bullet.
I see it different ways.
Any other comments or questions? Anybody online?
Perhaps just one more comment, kind of pursuant to the discussion that's been occurring. I realize that it's easy to, much easier to just say, a standard $10 increase across the boards, but perhaps next year, maybe some playing around with the numbers could be done to determine maybe a percentage amount based, a standard percentage amount that the prices would be increased, kind of based on consumer price index and, what it does to the total numbers and comparisons with other local facilities, just to kind of see what that would mean for both the budget as well as the comparability across facilities, but something to do and consider for next year.
Thanks, Cindy. Anything else from anyone? Well, I need a motion to approve the rate increases, so we can move it on to.
You've got the motion, I believe.
I think so.
So all in favor, please say aye.
Aye.
All opposed?
Aye.
Let's move on to county board. Thank you. Right, item 14, any correspondence and future agenda items. We do have down Leanna was gonna look into those other,
Yours or mine.
Look into those other.
yeah, where it's not spelled out.
There are other reductions.
Yeah,
Yeah, that was that federal,
That was
yeah, that 2% was that federal,
well, that was one, but I thought there was another one she said she was gonna look into.
oh yeah, the other liabilities.
Yeah.
Liabilities, just have to figure out.
Yeah, that would be the only thing for sure. Anything else anybody want on the agenda for next month? Hey, wait.
The only thing I think that HHS might have would be, tab grant. That one will have.
If not, I need a motion to adjourn, please.
To adjourn.
Second? Okay. All in favor, please say aye.
Aye.
Say one.
That's right.
Thanks, everyone.